You're a Roman citizen. It's 100 AD. You just lost your job at the docks. You walk to the government grain warehouse in Rome. You show your citizen tag. You get free bread. You get free oil. Sometimes you get free wine. This is called the Cura Annonae, and it has been running for over 200 years. There is no line at the DMV in 100 AD. There is no line at all. The Romans just hand you the bread. Now imagine walking through the same kind of city in 1750 London. There is no warehouse. There is no free bread. There is only a private insurance office that will sell you a policy if you can pay the premium. Something happened between Rome and London. Something big. Something that would keep happening, back and forth, for 2,000 years. The story of insurance is often told as a straight line from ancient contracts to modern State Farm. That is not what actually happened. Insurance has been swinging back and forth between public collective systems and private commercial markets since before the Roman Republic. Neither side has ever definitively won. The argument you probably have opinions about today, whether healthcare should be public or private, is actually one of the oldest arguments in Western history. So how did insurance swing between public and private for 2,000 years? And why does the pendulum keep swinging back? The answer covers Egyptian temple storerooms, Roman grain warehouses, medieval monasteries, Hanseatic guilds, one very specific London bakery fire in 1666, Otto von Bismarck's absolutely brilliant political calculation in 1883, and every American healthcare debate ever held. Once you see the pattern, this fight is not new, it is ancient, and it is not going anywhere. Let's start at the beginning. Long before insurance existed in the modern sense, there was collective storage. Around 2500 BC in Egypt, stonemasons working on the great tombs pooled monthly contributions into a shared burial fund. If a mason died, his family received a proper burial paid for by the collective. Temples across the ancient Middle East ran similar systems for grain, oil, and wine. When crops failed, the temple opened its storerooms. This was insurance run as a civic and religious duty, and it worked. Around 123 BC, a Roman politician named Gaius Gracchus took this idea and turned it into state policy. He proposed a law that would guarantee grain at a subsidized price for every Roman citizen. Both he and his brother Tiberius, who had proposed land reform 10 years earlier, were killed for their politics. But the grain law survived and grew. By the reign of Augustus, the Cura Annonae was distributing free grain to about 200,000 Roman citizens every month. The Romans built a fleet to bring it in from Egypt. They built massive warehouses along the Tiber. They invented the first serious bureaucratic administration in Western history to manage the whole operation. Honestly, it was one of the most sophisticated public welfare systems ever attempted, and it worked. For centuries, when the Western Roman Empire finally collapsed around 476 AD, the last thing to go was the free bread. Here's where it gets genuinely interesting. The Middle Ages did not abandon the collective idea. They moved it out of the state and into the church. Monasteries across Europe ran the first medical hospitals, the first orphanages, the first pension homes for aged workers. The Benedictine rule, written around 530 AD, required every monastery to keep an infirmary and receive the poor. For nearly 1,000 years, if you fell sick and could not work, the nearest abbey was your health insurance. Then, starting in the 1400s and 1500s, something new emerged in northern Germany. The Hanseatic League cities of Hamburg, Lübeck, and Bremen built private craft guilds that ran their own collective funds. When a member died, his widow received a lifetime annuity. When a member fell sick, his family received emergency support. These were not state programs. These were voluntary agreements between working men who wanted to protect each other. The Witwenkassen, the widow funds of Hamburg, were still paying out into the 18th century, and they were the direct ancestors of what came next. Now here is where the pendulum swings hard the other way. On the 2nd of September, 1666, a fire started in a bakery on Pudding Lane in London. 4 days later, 13,000 houses were gone. Total damage was about £10 million. The city's annual income was £12,000. The math was catastrophic. Into that catastrophe walked a London economist named Nicholas Barbon, who saw something the ancient world had never quite grasped. If a private company could pool the risk of fire across enough houses, it could sell protection at a profit and still pay every claim. In 1680, he founded the first modern fire insurance company. He hired his own private fire brigade. He put small metal plaques called fire marks on the houses he insured, so his men would know which ones to save. Within a decade, competitors were opening across London. In 1688, a coffeehouse owner named Edward Lloyd started serving merchants and ship captains in Tower Street. His clientele began writing insurance contracts on the ships that came and went. That coffeehouse became Lloyd's of London. In 1706, the Amicable Society for a Perpetual Assurance Office wrote the first modern life insurance contracts. In 1762, the Equitable Life Assurance Society added actuarial mathematics based on Edmund Halley's mortality tables from 1693. For the first time in human history, risk had a calculated price, and private markets were selling that price to whoever could pay. It was one of the great financial inventions of the modern era. In about 100 years, London had built the financial infrastructure that would go on to fund the entire Industrial Revolution. Here is why all of this still matters. The private system, brilliant as it was, left large parts of society outside the market. Working people, the elderly, the sick, and those with no capital could not always afford the premiums that made the mathematics work. In 1834, England reformed its poor laws to expand public responsibility for the destitute. In 1883, the Prussian Chancellor Otto von Bismarck went much further. He looked at his rising industrial working class, calculated the political threat of the Social Democratic Party, and made one of the most consequential decisions in modern history. He built the first national health insurance system in the world. In 1884, he added accident insurance. In 1889, he added old age pensions. Bismarck was not doing this out of pure kindness. He wanted to outmaneuver the socialists. The political strategy failed. The Social Democrats became the largest German party by 1912. But the system he built became the model for nearly every modern welfare state. The United States Social Security Act of 1935, signed by President Franklin Roosevelt. The British National Health Service of 1948. The Canadian public health system that came together in the 1960s. And in 2010, the American Affordable Care Act, which attempted to combine private insurance markets with public subsidies in a hybrid model that continues to be debated today. Every one of these systems inherited something from Rome, something from the guilds, something from Barbon, and something from Bismarck. The pendulum kept swinging. It has never stopped. So the Roman citizen at the government warehouse in 100 AD, and the London merchant at the private insurance office in 1750, and the American picking a health plan on a website today, are all part of the same argument that started before the Roman Republic and never ended. Public or private, collective or market, guaranteed or bought. The specifics change, the countries change. The technology changes, but the fundamental question of who carries the risk of being human is one that every generation has to answer for itself, in its own way, with the tools it has. There is a truth underneath every insurance system ever built. Risk does not disappear, it only moves. When the state carries it, everyone pays through taxes. When the market carries it, some people pay premiums and some people go without. When the family carries it, mothers and fathers stay up at night hoping nothing goes wrong. Every system in human history has been a different answer to the same question, and every generation has renegotiated the deal in the light of new problems. Both the public and the private tradition have produced extraordinary human achievements. Rome fed its citizens for over 500 years. London built the financial infrastructure that powered the modern world. Bismarck built the welfare state that most of Europe still runs on today. Every one of these was a genuine act of human ingenuity, built by people who thought hard about the same problem you are still thinking about when you sign your next insurance form. The Roman warehouse is gone. The London coffee house is gone. Bismarck is gone. The question is still here.